Namaskar, I am Dr. Tarun Jindal, Senior Consultant of Uro-Oncology and Robotic Surgery at Apollo Multispeciality Hospitals, Kolkata. As a uro-oncologist, I treat the cancers of kidney, prostate, bladder, ureter, and the other concerning organs of our urogenital system. These cancers are very common in the community. There are certain reasons for that, because there is a habit of tobacco ingestion, there is a habit of smoking, the environmental pollution, the dietary factors, all of them lead to a very high incidence of urological cancers in the community. And we as urosurgeons are able to assist the patients who develop these kind of cancers. As uro-oncologists, we were always inclined towards the betterment of our patients, and we were always contemplating as to how we can increase and improve our results. So uro-oncology, which started with a conventional open approach, evolved towards minimally invasive approaches like laparoscopy, because we believe that the less we cut open the patients, the less trauma we cause to their body, the less pain we cause to their body, and they are fit and fine in a shorter span of time. Hence, from conventional open surgery, we started moving to minimally invasive approach, which was laparoscopic approach. But we were still not very happy. We presumed that there is still a lot of work which can be done in improving the results of uro-oncology. Hence, we were the first group which moved on to the use of robotic surgery in the field of medical sciences. Robotic surgery has phenomenally improved the field of uro-oncology. Now we are able to do the most complex surgeries which were at times very difficult even with the open approach. We are just able to complete them with robotic approach with minimal amount of trauma to the patient's body, and the recovery is fantastically fast. The patients are able to resume their work very quickly, and they are able to return back to their normalcy in no amount of time. So we uro-oncologists have to treat the cancers in the organs which are very deeply seated into the human body. So kidney is a very well protected organ which is covered by bones, which is covered by muscles, and to reach that area, it's a very difficult task by an open approach. So you have to give long incisions, and which mean that the patient will be suffering with a lot of pain in the post-operative period. But with the advent of minimally invasive surgery and the latest robotic surgery, we are able to reach those organs by just giving around 8 to 10 millimeter of cuts on the patient's body. And whatever extensive tumors we are dealing with, we are able to remove them successfully without inflicting too much of trauma on the patient's body. And this has resulted into faster recoveries. Now patients are able to go home within 1 or 2 days, which was unheard of previously. The blood loss is minimal, the recoveries are faster, the patients are pain-free, and they can resume their normal activity in no time. Robotic surgery at Apollo Hospital is setting a new benchmark in itself. We have the most latest machine, which is called the Da Vinci Xi. There are numerous advantages which this platform has over the predecessors. We can do multi-quadrantic surgery. So just imagine if somebody has a tumor in the kidney, and we are also supposed to remove the entire ureter. We now need not reposition the patient. With the same cuts, we can go to any part of the body and remove the tumors from any part of the body. This basically means that the number of cuts which are required on the patient's body are much less than any other system. So this is culminating again into very quick recoveries, very complex surgeries being done very efficiently. The machine gives you so much of advantage, and I'm very happy to inform that this is the only center which has this machine presently in the Eastern Zone. So my message as a uro-oncologist would be, please don't be afraid of cancer. Every human being has a specific percentage of developing a cancer, but the main important thing is that if we are able to diagnose the cancer early, we will be able to give you fantastic results. Please do not neglect your symptoms, specific symptoms like issues with urination, if you find blood in urine, if you have pain in your flank, if an ultrasound picks up an abnormal mass, please consult a specialist. If we are able to catch them early, rest assured your life will never be at a problem or at a risk because of the cancer. Diagnose them early, treat them early, and give them fabulous results. This is our motto to treat cancers.